My name is Scot Aita. I'm from Omaha, Nebraska. I was raised here. I was born in Baltimore, Maryland. My parents were finishing up training and education, and when they finished, we moved back here to where they'd both gone to high school. I did my internal medicine residency, intern year in residency in San Antonio, Texas. I did my gastroenterology fellowship in San Antonio, Texas, and then I did an additional hepatology fellowship in Chicago. I am a gastroenterologist. I became interested after I'd been an internist for about 2 years. I deployed overseas, served as kind of a general internist and also administrator for an Army organization. And when I came back, I had the privilege of seeing a few patients with gastrointestinal disease. And I'd never really thought about gastroenterology until that point. I'd been thinking about some similar fields, cardiology or critical care medicine and pulmonary medicine. So I would attribute my change into gastroenterology after having seen and evaluated these patients. What I like about gastroenterology is there's a broad depth to the field. On one day, you'll see patients with liver disease, which can be very complex at times. And on the next day, or even the same day, you'll talk to a patient about colon cancer screening. And so there's a wide variety, including infectious disease, autoimmune disease. Common conditions that I treat as a gastroenterologist would be sitting down and talking with a patient about reflux disease, screening for Barrett's esophagus, which is a precancerous condition of the esophagus, colon cancer screening, screening for liver disease and or treating liver disease, seeing patients in the hospital who might have exacerbations of autoimmune conditions, whether it's inflammatory bowel disease such as ulcerative colitis or Crohn's disease. I'll see patients in the hospital who are suffering from acute pancreatitis. You also see people with infections, whether it's H. pylori infection of the stomach. I've seen some patients in the military or who have not been in the military but have traveled overseas, whether through the Peace Corps or just travel, who come back with parasitic infections. And it always amazes me how easy some of these treatments are, literally 3 days of treatment to cure a disease that's been causing significant symptoms. It's important to understand where people are coming from. It's one thing to prescribe a medication, but it's a completely different thing to be the one taking it. Imagine being a truck driver and you're being asked to take an eye drop 4 times a day or something. How are you going to do that? How are you going to fit into your schedule or things like that? And so I always want to gain a patient's perspective on how they perceive their disease and really come up with a plan that's in keeping with their goals and how to get them better.